Hi, I'm James Rippey and I'm going to give a quick talk on how to look after our ultrasound probes, which directly benefits our patients. The take-home messages are going to be that you should use a probe cover if it's going to get messy. That means if you're doing procedural ultrasound, always use a sterile probe cover. If there's any chance you're going to get patient bodily fluids onto the probe, use a probe cover. I'll tell you where to get the probe covers in our department and how to put them on. The other big take-home message is going to be how to clean the probe once you've used it. It's not uncommon for us to come into the emergency department to find an ultrasound machine looking a bit like this. There can be blood, chlorhexidine, bodily fluids over the transducer or over the machine itself. Obviously, this little demonstration involved a trip to the cafeteria and some tomato ketchup, and no patients were harmed in the making of this video, but it is a very serious issue. In our department, we have two ultrasound probe covers. Both are sterile. We've got the simple plastic bag, which is very useful for just keeping the probe clean when you're doing a fast exam, for example, on a dirty patient. With procedural ultrasound, I prefer to use the longer sterile plastic bag, which is concertinaed nicely for ease of putting onto the ultrasound probe. There's also a sterile container of ultrasound gel in this pre-packaged container, and also two sterile elastic bands. These probe covers are kept on the back of each ultrasound machine, as well as in the ultrasound procedure trolley and in the standard storage areas. When you open the packet, this is what you see. Obviously, it will be done in a pre-prepared sterile area, but you open this little sterile packet. There is the sterile gel, here's the concertinaed sterile plastic bag, and there are the two elastic bands. So that's what you get. To put it on, you open the concertinaed plastic bag, turn it slightly inside out, open the sterile gel and put a good dollop into the plastic bag. The sterile side will be where the gloved hand is. You then quite easily by yourself place the bag over the probe and carefully pull the plastic bag down over the length of the cord. Making sure there's no air between the plastic bag and the transducer, you put on the elastic band, and there you have it. An ultrasound probe which is sterile for about 1.5 meters from its tip up the wire. With the sterile field, you can then carefully place that onto the sterile field and ensure that it stays sterile, being careful not to touch it on anything non-sterile along its course. When you've finished, washing the probe is really important, and it's not rocket science. Pop it under the tap and just wash it as you would your hands. Make sure there's no gel on it, no other bits and pieces. You get some soap, give it a good wash, and there you go. Nice, clean ultrasound probe. Obviously, if there's any gel on the cord, wipe that down. There we go. Not too tricky. Pop that in the bin. And hey presto, we've got ourselves a clean probe. If you get any patient bodily fluids onto the transducer or the cord, it's really important that it's decontaminated properly, and that involves high-level chemical sterilization. There are a number of options for that. One is the Trophon, which uses hydrogen peroxide. Another is Sidax, which is orthophenaldehyde. And the third is Tristal, which uses chlorine dioxide. Hopefully, if you use a probe cover, the probe won't be contaminated. And if it's not contaminated, washing it like that is fine. Obviously, this isn't true for transvaginal or transrectal ultrasound probes, but for ones used on the skin, that's fine. So once you've washed it, just to perfect our cleaning, there are the probes on the back. There's this stuff called T-spray. It's a slightly milder disinfectant. It's not a high-level disinfectant, but you get your cleaned probe, give it a couple of sprays one side and the other. Make sure it's nicely covered with this bactericidal, which you then let dry. and then as well as having a clean probe, it's disinfected to a slightly higher level. To try and show our colleagues that the probe's clean, we've decided that we're going to put one of those cheap sterile plastic bags over the top of the probe. If you see that, that means it's clean. Go ahead and use it, that's fine. Obviously you'd open a new sterile probe cover if you were doing a procedure. So the take-home messages: use a probe cover if it's going to be messy, and now you know how to put them on. Clean the probe once you've used it. Just do it, there are no excuses. And if it's contaminated with body fluids, then it needs to go up to the formal sterilization unit where they'll use chemical high-level sterilization. That's the end.